Hello, dear viewers. Imagine I'm moving through a busy traffic area in a polluted atmosphere. I have left from my home to go to my bank and withdraw some money. And there, see what I found. The bank is closed. Then, for the amount of risk that I've taken, and that even in this COVID times, what is the benefit I've got out of it? So, the benefit has been withdrawn for the risk I have taken. So, this is the basis of today's presentation of mine. And if you remember, I had left you with the question of the patients, the undue exposure they may get when they come to nuclear medicine, if at all, for any kind of reason. What are the reasons when they may get such kind of undue exposure? So let me take you to my presentation. So, when do patients receive undue exposure in nuclear medicine? When the benefit is withdrawn out of the calculated risk taken. Now, let me show the contents of my presentation. Meaning of undue exposure, what is it actually meaning? Technical factors like misadministration, failure of equipment, poor quality of radiopharmaceutical, extravasation, inadequate data acquisition. And patient-related factors, preparedness of the patient, vomiting, contamination, or movement of the patient during the procedure, especially the imaging procedure. Now, what is undue exposure? When an individual receives radiation dose which does not give any benefit and that which could have been avoided. The misadministration, what's misadministration? Wrong patient. That is, the dose that you have withdrawn may be right as on paper, but the patient who has been called is a wrong patient. That can be leading to misadministration. What about the wrong radionuclide? The patient whom you have called is right, but the dose that you have withdrawn for the patient can be wrong. And then the wrong dose or wrong route, what do they mean? The wrong route is if you had to inject intravenously, it has gone in subcutaneously. That is also misadministration. And wrong dose in the sense, instead of low dose therapy dose, the dose has been high dose therapy given to the patient or vice versa. And you may think if it is a high dose patient, then if low dose is given, you can back up with the extra, but this is not so. The low dose given can be unnecessary or unwanted, or you can say it will not solve the purpose. And so this can be an issue of misadministration. Now, for example, for contraindicated case, it will be to a pregnant female who has not been checked for her pregnancy and she has been injected this radiotracer without being aware of her status. The fetus is going to get undue exposure also, along with the female who has been called for, and in this case could have been avoided. Now, for the failure of equipment, the quality control of the equipment fails, the instrument breaks down, and this all happens after the dose has been administered to the patient. It means the patient has got the exposure, received the dose, radioactive dose, but the scan, that is the output, is not going to be given. So this is the benefit is no for calculated risk taken. Now, then the poor quality of the radiopharmaceutical. The radiopharmaceutical has higher percentage of radiochemical impurities, then these will localize in non-target areas. As you can see in that picture of animation, the target area is where the vector molecule will have to stick, the pharmaceutical part of the radiopharmaceutical, and the radioactive part will go along with the vector molecule. Suppose this radioactive part and pharmaceutical have been broken by that bond, their bond is broken, that comes a radiochemical impurity, and that only radioactivity will move into some non-target area and expose unduly inside the patient's body. Now, for the preparedness of the patient will not cooperate or may not be cooperating because of his fears, which have not been clarified during the informed consent procedure. That is, the non-cooperation of patient to undergo the procedure post-administration. You have to prepare the patient for the informed consent time, and this can be done through tailor-made specifically for the patient, being patient-centric, and optimize your counseling thing because activities, because this may be like, it cannot be every patient is unique and he or she may need different requirements of emotional support, or for that matter many other kind of clarifications can be required. Some patients may not require any clarification and they are very much ready to take the procedure. Such patients, informed consent may not take so much of the time, but this time is a very precious and very important one, because the patient, if he doesn't get prepared, then all after the dose administration, if he comes to the procedure area and he says, I cannot get it done, then you feel very bad for having injected that patient. Now, as for the extravasation, it is as very much equivalent to the wrong route, you say, where the dose has supposed to be intravenous and it has gone and stayed under the skin, and this will be irradiating that small area. And if at all this happens to a therapeutic dose, then it will be really very serious, because that can also necrose that area because of the beta emitting radiation. Now, the inadequate data acquisition. For example, if the study was requiring a vascular phase, the initial dynamic phase, where the patient has been injected the radioactivity and then called after 3 hours, for example, in a bone scan, we do that way. Then the initial phase has been lost, and the interpretation cannot be done without these kind of very important phases. And then you may have to redo the scan. And this is an undue exposure. Although you cannot say that there is no benefit at all, but this is not a complete data, and you have to give another dose on another day, if at all you want to wait for the TK time of the initial dose too. As for the vomiting, if the patient throws out the administered dose, especially the therapeutic dose, then the purpose is completely lost. And the patient will only face the undue exposure, and more so even the area becomes contaminated, and then that vomit and the patient has, which is actually containing the patient's valuable dose, will be just exposing the external exposure also, and such kind of undue exposure is possible. Now, for contamination, as I have already told you in the initial slide of the vomiting, that this and any other body fluid, even urine contamination by pediatrics on the body surface in the waiting area, till the till the screening is done, it is going to be exposing the patients around there, not only the patient who has actually been the cause of this kind of contamination, but also the others sitting out there nearby, or the optimal distance, although. Now, as for the movement, if the patient is moving excessively in the imaging time, especially the dynamic imaging time, what happens is the whole study may have to be repeated, will have to be repeated. For example, as I've shown you in this picture, that the kidney is moving beyond the region of interest, and you cannot field of view beyond the field of view, and this region of interest cannot even be drawn to get the time activity curve, which is very important for the to get the functional study of the kidneys. And this is how the sinogram or the motion images stacked on together, motion to get the graph of how much patients have moved. You can see that this is a bad one, and this is the bad one, and this is how it's supposed to be. And this is called a sinogram. And the patient motion, a lot of patient motion can also get finally call for a redo scan, and this can cause the undue exposure for the patient. Of course, to all the stuff, but because we are sticking to this point today, we have to think about the patient's undue exposure. Now, let me summarize all the points that I have talked about in this presentation. It is about the meaning of undue exposure, the technical factors for this undue exposure, misadministration, failure of equipment, poor quality of radiopharmaceutical, extravasation, inadequate data acquisition, and the patient-related factors, preparedness of the patient, vomiting, contamination, and movement of the patient during the acquisition, especially the dynamic acquisition. Now, my parting question to leave you with, that is, how is a patient prepared before a nuclear medicine procedure? Thank you.